Breast cancer. Nowadays, if you ask the oncologist, cancer specialist, they say breast cancer is a common affair. Just if you just cross 30-40, you just check your breast, come for mammography, just see your hormonal level, etc. But why you should test your hormonal level? Why you should test your breast by applying your own palm, just see whether there is any growth or anything like that. What is breast cancer? How does it develop? What is breast first? For both boys and girls, breast is present. Only when the girl reaches the stage of maturity, puberty, breast develops. At that time only menstrual cycle starts. So until then the breast is not developed, it is flat. What is the cause of development of breast? It just doesn't develop. It is related to the female hormone which is secreted by the ovary. Breast develops here, ovary is present in the pelvic region, the lower abdomen, but ovary doesn't secrete estrogen until the age of 10, 11, 12, 13, etc. So only when the girl reaches the stage of maturity, estrogen actually starts developing, or it is getting synthesized by the ovary. Until ovary is there, but it is not secreting estrogen. What is the triggering factor for estrogen secretion? The order comes from the pituitary. Pituitary also is developed, but why it is not giving the instruction for the ovary to secrete estrogen until the age of 10, 11, 12, 13, until the girl reaches the age of puberty. Until then, until this girl reaches the age of maturity, it is under the control of another endocrine gland, that is called pineal gland. It is related to Sahasrara chakra. It gives order to the pituitary gland to secrete one hormone called follicle stimulating hormone, which actually activates the ovary to secrete estrogen. Only when the estrogen is secreted by the ovary, breast starts developing. Only when the girl reaches the age of maturity, breast develops, it grows in size. So the growth of the breast is under the control of estrogen secreted by ovary, which the ovary itself is under the control of pituitary. All these endocrine organs are not independent, they are interrelated. So when a person goes with a breast cancer, what is that is being done? Biopsy is being done, then they say it is tumor or breast cancer. Sometimes they remove the breast itself, or sometimes it is only in the initial stage. It is enough if you go for chemotherapy, radiation, etc. But it is not. Sometimes they remove the breast itself. Removal of the breast itself is not sufficient. That is not going to solve the problem. Again, one breast shows the symptom of breast cancer. After some time, the other breast also may show the symptom of breast cancer, or by doing surgery, another later on, by metastasis, some other organ will show the symptom of cancer, maybe in liver or brain or spinal cord, etc. But what is the solution? So you have to go to the root cause of the problem. Nowadays, even girls are given contraceptive pills. Hormones are indiscriminately used. So when a lady reaches the age of 45, 50, that is the stage called menopause. At that time, if she shows, according to the oncologist, only in the later stage the breast develops cancer, you may develop cancer, you come for checkup. So the doctor has tendency for the development of the tumor. Supposing the lady says, I got some problem with ovary, uterus, etc., excessive bleeding. Immediately the doctor says, go for hysterectomy. Already you have produced 2 children, 3 children. Why do you want uterus? Why do you get rid of? Hysterectomy is done. After removal of the ovary, after removal of the uterus, they go on pumping hormonal replacement therapy. That is not required. So once the lady is identified with breast cancer, what you can do, if it is in the initial stage, not in the later stage, first stage, second stage, third stage, fourth stage, there are different stages of cancer. If it is the first stage or second stage of cancer, yes, we can go to the breast, which is related to the Anahata chakra. But breast is actually, breast development, I have already told you, it is related, it is depending on the estrogen secretion. If you pump more of hormone into the system at the stage of menopause, the reproductive capacity comes to a standstill. It doesn't produce optimum quantity of estrogen, which is meant for regular menstrual cycle and also for reproduction. But ovary doesn't stop producing estrogen. A small quantity of estrogen is being produced until last, in the case of ladies. That estrogen which is being produced until after the menopause, that is meant for protecting the bone or to prevent osteoporosis. But what happens, doctors immediately they say, you have got very small quantity of estrogen, you have to take hormonal replacement therapy. When naturally normal physiological process is to allow the ovary to secrete small quantity of estrogen. At that time, if you pump hormone into the system, the ovary starts producing more of estrogen, then automatically breast starts developing. Breast also cannot secrete milk because it is a menopause stage. So breast develops. What will happen? It starts showing the symptom of tumor or cancer. Which is responsible for this? Injecting more of hormone which is not required under particular stage. So removal of the breast alone is not the solution. You have to treat the cause. You go to the Agni chakra, which is having the control over the pituitary gland. Then treat breast by going to the Anahata chakra. Breasts are present here. Anahata chakra also controls the breast development. But whereas the ovaries, two ovaries are present in the lower abdomen, within the pelvic cavity. Go to the Swadhisthana chakra, automatically ovary starts producing the required quantity of estrogen. It will regulate itself. Hormonal balancing takes place. Because of hormonal imbalance, breast cancer comes. Because we are pumping estrogen or hormone into the system which is not required. So hormonal balancing takes place by going to the chakras, Agni chakra, Anahata chakra, Swadhisthana and Mooladhara chakra. In addition to this, we can also treat by what is called acupuncture. Pituitary gland is present here. So pituitary gland is part of the brain. So you just apply pressure here. There will be painful point. At this place, a painful point occurs. At this place where if you apply needle, automatically pituitary gland starts producing optimum quantity of estrogen, or it controls the activity of estrogen or ovary. Then you go to the two breasts are present here. They are related. This is the chest. Two breasts are represented here. You apply pressure here, automatically even when you are diagnosing, the patient feels some reduction in the pain. See, when there is breast cancer or tumor, the patient feels the pain when she applies the hand on the breast. Automatically when she applies, with the intention of diagnosing, when I apply pressure here, automatically patient feels the response. So we can just touch the correct point. Apply needle for two breasts here. So then two ovaries. Ovaries are in the lower abdomen. Lower abdomen is present here. One ovary here, another ovary here. Treat the two ovaries, treat two breasts and also pituitary. This is the solution for treating breast cancer. Breast cancer by removal of the breast cannot be treated by chemotherapy and radiation alone. But only thing is, for people who are going for treatment, chemotherapy and radiation, they can also combine with acupuncture and Reiki automatically, because when the patient comes with breast cancer, if they are already taking treatment with oncologist, cancer specialist, I am not asking them to stop going for this treatment. Chemotherapy and radiation can be done. After removal of the breast also, some people have got other symptoms like gland develops here, it becomes enlarged, hand is becoming painful. All these the secondary reaction can be healed by going to the people. So it can be, allopathy can be combined with Reiki and acupuncture. So I never ask the people to stop going for chemotherapy or radiation. Combine this one. If you have got breast cancer, whatever treatment you are taking, whether it is allopathy or Siddha or Ayurveda or allopathy, just combine this one. Automatically the symptom of breast cancer comes down, because we go to root cause is in the pituitary gland, which is having control over the ovary. Ovary has got control over the breast. All the three are to be treated by healing the corresponding chakras. But only thing is, in addition to this, breast itself is a external growth of the skin. So in case of breast cancer, you can select the point in the lung meridian. Lung is related to the skin. So you can select one point. I usually diagnose by selecting the point. We go to the particular element and then treat the case. Automatically, by going to the meridian also, lung meridian, skin develops. The breast is the outgrowth of the skin. That can be treated by going to the lung meridian. This is how we treat the breast cancer.